Welcome back to part 3 of our discussion, a doctor's prescription for living beyond diet and exercise. So as you recall, in part 1, we established that America is very ill and that our health is basically in flames. Part 2, we established the diagnosis and made the case that mindless consumerism is the reason for the rise of chronic diseases that we're seeing in America and abroad. And part 3, we're going to discuss the prescription for that. And so, when you first hear the diagnosis that mindless consumption is the reason for our ailments, and if you're convinced of that, then your natural inclination is to think, okay, well, we just need to be more mindful of our consumer habits, and we'll become healthier as a society. And in theory, that may well be true. We could get to becoming healthier by becoming more mindful consumers. But in practice, what we find is that if you try to convince people to become mindful of consumption in order to live healthier lives, you're going to attract a very few segment of our population. You're going to probably attract those who are a handful of very virtuous, high-minded, noble individuals who spend all their time thinking like the folks in this picture. But for the vast majority of people, that's not going to be an attractive option for them. There's simply too much appeal to the consumer-oriented lifestyle. There's a lot that consumerism has to offer, if you will, that if you want to engage these individuals, you'll have to take a different approach. And so the good thing is that with the prescription for living that I'm about to discuss with you, I think you can engage nearly 100% of individuals to embrace this different way of living. So as it turns out, the path to healthier living happens to be the same path to becoming wealthy. And that, to most people, is a very attractive proposition. They like the idea of becoming financially independent of their employer. They like the idea of getting to the point of being able to meet their needs without having to depend on their employer. So to get to the point of becoming financially independent of our employers, we have to understand a little bit about the basics of finance. And if you've read any kind of books at all about finance, about personal finance, you'll come to see that you could distill it down to 2 pieces of advice. The first is that we should live below our means. And the second is that we should invest the rest. And basically, all of finance is as simple as that. Now, if you add in what we discussed in part 2, and we discussed the science of well-being and came to the conclusion that the best things in life, once we've met our basic needs, are free of cost, then that essentially opens up the possibility that we should be able to live well below our means for the vast majority of us. And so that means that we would be able to invest a much more significant amount of our income than the typical financial planner would usually recommend for most Americans. So if you ask most financial planners, they'll tell you to put away 10% of your income into your investments. Maybe if they're being really aggressive, they'll tell you 20%. But I'm convinced that, based on the science of well-being, that we can invest a far larger share of our income without having any impact, adversely impacting our happiness. And so you could cut down on consumption without, in fact, sacrificing happiness. In fact, it's going to actually lead to greater levels of happiness. And we should be able to invest a much larger share of our income. And that, over time, will lead to the point of becoming financially independent. And financially independent means that whether you work or you stop working, you'll still have the income that you need. You'll still have the money that you need flowing from your investments to be able to support your day-to-day living. And that doesn't necessarily mean retiring. I hope not. I actually think that life gets to be so much more interesting once you get to the point of becoming financially independent. And then you get to see things from a vantage point that very few people, unfortunately, in today's society are able to see. And so you might decide that you want to continue working with your same employer. You might decide you want to start up a new business. Perhaps you want to spend some time in some other ways. But whatever it is, you'll be able to enjoy a level of freedom and a level of agency that you did not have before. Whereas before we're tied to our employer, kind of directed by our employer how to live our lives from 8 to 5. Now we have a certain level of freedom that enables to be able to do so much more. So this prospect of being financially independent of our employer is one that's very attractive to folks, and it's in fact very liberating, as you might see in this picture here. It's so attractive that even young high school and college students out of college, you can engage them. Even they would be very much attracted to finding out how to curb how much they're purchasing, their consumption, in order to get to this level of becoming financially independent and free to be able to live the sort of lifestyle and the sort of life that they would like. Now, as you would readily see, just because we're financially independent doesn't necessarily mean that we're automatically going to be healthy, but you can see that it optimizes those conditions for healthier living. So, as we saw in part 2, mindless consumerism in these various ways was the reason we're experiencing the rise of chronic disease in America and abroad. So by becoming mindful consumers, we can break some of these links. So for example, we're no longer stuck in a situation where we're basically forced to live in a way that's hazardous to our health. We're no longer sedentary from 8 to 5, or at least not necessarily. We're also not necessarily going to be transformed in the way that we are now. In today's world, we have to work for money, and the product that we're selling, or the product or service we're selling, is sort of a side effect. And in contrast, those who are financially independent get to work because they're passionate about their product or service that they're selling, and money is instead the side effect. And so that means that we're providing things for people's welfare, as opposed to trying to make ourselves enriched. And so just in those couple of ways, you can see that we're setting up the conditions whereby healthier living is possible. Now, that doesn't necessarily mean that we can break this link here where we have engineered out exercise and where we have changed our environments to the point that it's becoming increasingly artificial. That's going to take many more of us to become mindful consumers. In other words, it's going to take societal change. And although I don't have time to discuss that in this presentation, you can read in the book how that is possible through certain policy interventions. So as I'd kind of hinted earlier, the diagnosis was really the hard part, establishing that mindless consumerism was the cause of the rise of chronic disease in America and abroad. The prescription, as I talked about, is very simple because it's very attractive. Most people want to become financially independent. They're happy and willing to cut down on consumption in order to get to that point. But there is an alternative. There is an alternative to the prescription that I had proposed, which is what our politicians prescribe. So as it turns out, our politicians have a different prescription for a living for us. They envision that, in fact, we should do exactly the opposite of what I'm suggesting. That instead of reducing mindless consumption, we should in fact spend more money. And by spending more money, by their reasoning, we'll become increasingly productive. And by becoming increasingly productive, we'll be able to innovate more. And so by innovating more, we'll be able to contain a lot more of the chronic diseases that we can barely manage in today's world. So, for example, we will be able to better manage diabetes or obesity or Alzheimer's. We might even be able to cure some of these diseases because we'll be able to innovate our way through to better solutions that help us to treat diseases much better than we can in today's world. And you know what? The fact of the matter is, they are right. They are right. We would, in fact, be able to better manage chronic diseases just by spending more and innovating more and getting to the point of being able to find things through technological advances. But here's the problem. Here's the problem. We have to differentiate between chronic disease management on the one hand and healthy living on the other hand. In terms of chronic disease management, yes, by spending more, we will be able to innovate more and be able to manage many of the chronic diseases we could barely contain in today's world. But there is a better option, which is we can actually prevent a lot of these chronic diseases by enabling people to become free in a way that they're not today. And what you'll also notice is that the things on that contribute to healthy living are largely free of cost once we've met our needs for a nutritious diet. So food, of course, costs a little bit, but most of us are able to afford that in today's world. But those other things that we need for healthy living, exercise, good sleep, spending time outdoors, spending time with family and friends, those don't cost anything. Those things are free of cost to us. Any kind of technological solution to innovate, to replace those things that we need for healthy living are going to produce suboptimal outcomes, whether that's exercise in a pill or whether that is a replacement for sleep somehow. So the point is that by curbing in consumerism, we'll be able to live healthier lives. Not to mention that also has environmental benefits, it also benefits biodiversity, and we benefit in a number of other ways as well. As you can see in this graph, our GDP growth per capita has been tremendous over the last couple of 100 years. We have become incredibly productive, and despite that increase in productivity, we continue to work in unhealthy environments for more and more of our time. And so the problem is that really our politicians, whether they're on the left or on the right, their overarching societal goal for us is to increase our productivity. Somewhere along the line, they seem to have conflated our goal of happiness and well-being with that of productivity. But you and I, we're not machinery. We're not a cog in a wheel. We actually aim to be healthy and live a life that is more meaningful and one that ultimately is more happy. If you want to follow the politicians' advice, then, do as they say and continue to spend ever more, continue to spend mindlessly, and that's going to be what we end up continuing to do. But if you want to follow the science of well-being and understand and embrace the fact that the science really tells us that once we've met our basic needs, that, again, the best things in life are free of cost, then that means that we should be able to consume much less, become financially independent of our employers, get to the point of doing things because we love to do them, not because we need the money. And the end result is that we're going to be happier, healthier, wealthier, more engaged, and simply better. Thank you. So for all of y'all who have made it through to this point, I hope it was inspiring. I hope you'll take some of these lessons and apply it to your life. I also know that I've crammed so much information into this introductory video series, and I want to be able to offer something more in depth. And so I'll be putting together a course titled Healthier, Happier, and Wealthier. And this is going to be in a beta testing mode. So I'm just kind of um, building the course with you. And we're going to be covering several topics there. We're going to be talking about a little bit more in depth about the science of well-being, what types of factors impact happiness, how to invest, what to invest in, how to get to becoming financially independent at a relatively young age. You're going to learn how to project wealth, uh, and also about how we can use capitalism for the good of society and for our good. Well, also, this is a course that in this video series, I actually talked very little about diet and exercise, which is somewhat surprising for a video series from a doctor about health. And yet, in the course, I'm going to go a little bit more in depth into that. And we're also going to talk about some of the long forgotten secrets that our ancestors were used to practicing that helped them to become healthy and to stay healthy throughout their lives. We'll, of course, touch on well-being for kids and teenagers. And we'll also talk about some of the benefits beyond just health, both to yourself as well as to society. So the course is going to have videos, it's going to have some quizzes, and it's going to start at an introductory rate of $37.50 for those who are interested in beta testing it. And for that, the course is eventually, after the initial testing period, is going to be $75. So during that beta testing period, for those who are interested in wanting to sign up, I do request that you provide me feedback, and I'm going to be reaching out to you, and we're going to be working together to optimize the contents of the course going forward. But if you decide not to, that's okay too. I want you to use the video series, and I really hope that this gives you an idea of how life can be so much healthier, wealthier, happier. And I'm really just kind of doing this because I have a passion for the message that I want to spread to all of you out there, and I hope you spread the message to others. So if you decide not to go any further, that's perfectly good, and I hope you just remember just a couple of takeaways that really the science of well-being teaches us that we can be masters of our own destiny, and we don't have to be stuck in an environment where it's almost optimized to live in a manner that's unhealthy for us. And so also one last word, we are going to be talking about things beyond what I've put together in the book, Health in Flames. So of course, we'll touch on several of those topics, but also go a little bit more in depth. So hope to see some of y'all in the course. Thank you.